Go.
All right, so we have Robert Crowley today. We're just gonna check the provider's orders real quick. It sounds like he needs to have transfused 1 unit of packed red blood cells over 2 to 3 hours is what the doctor has ordered. And let's just see how his results came back, just to make sure that that sounds appropriate for what he needs. So for his hematocrit, it looks like that is quite low, and his hemoglobin is also low, so it sounds like the doctor's order is appropriate. For blood typing, it looks like it was done about 2 hours ago, which is great, and that it is B positive blood, which is what we're going to be needing. I'm also going to check to make sure that we have the signed consent form. It looks like the doctor went over all of this with him, so that's great. All right, now that we have all of that, I'm going to go over and get some of my supplies. So I called the blood bank and they brought us up some blood, and it is B positive, which is great. We'll do our check in the room, but just looking at the blood, I'm just gonna make sure that it doesn't have any clots, that it doesn't have any purple color to it, or bubbles or leaks or anything like that. I'm gonna be making sure to use this within 30 minutes of getting it from the blood bank, and to use it over no longer than 4 hours, but in this case we want it to run for about 2 to 3 hours. I'm also going to grab my saline and my flush. Okay. And then I have my eyesight tubing. Alright, so I will go into the room. Hi, are you Robert?
Hi.
Hi, it's nice to meet you. I'm Liza. I'm going to be your nurse.
Okay.
I have some stuff for you, but before we get started, I'm going to look at your bracelet. Can you tell me your name and date of birth?
Robert Crowley, 1221.
Okay, awesome. And Robert, do you have any allergies?
No, I don't.
Okay, great. So the doctor has ordered for you a transfusion of red blood cells today. Sounds like after your surgery, we did some lab tests just to make sure everything was okay, and your blood values of hematocrit and hemoglobin are looking a little bit low. So is that all right with you if I get started with that procedure?
Yeah, that's okay.
Okay, and I'll just go over with you some of the different side effects and things to look out for. These red blood cells are really going to help you, but we do want to make sure that you don't have any reactions. So just some signs and symptoms to look out for is fever or chills, nausea, vomiting, headache or body ache, or just muscle pain specifically in your chest, your flanks, or your back. Or if you were to have an allergic reaction, you might have some itching or swelling or rash, or have it hard to breathe. So I'm going to be here for the first 15 minutes to make sure that if any of those things happen, that we get you taken care of. But does that make sense? Those are the things I want you to let me know about.
Yeah, that makes sense.
Do you have any questions?
Mm-mm.
Okay. All right, well, I'm just going to do a check over here with another nurse. Hi, can you come help me do a blood check?
Yeah.
All right, great. So we have Robert Crowley over here. So for starters, we'll check with the provider's orders. So he has ordered 1 unit of packed red blood cells over 2 to 3 hours. So this is the one unit of red blood cells.
Okay.
And then he is, for his blood type, over here, we've done it in the last 2 hours, and he is B positive. This is B positive as well. And then for here, I'm gonna have you read this blood unit number, and I can read it right here to make sure they match.
D9C5 850C8D1579.
Okay, awesome, thank you.
Yeah.
And then I noticed here that one of those numbers was off, in which case we would make sure that they were the same. DCE85. Okay. Okay, great. Looks like they match. Want to make sure. Thank you. And then we're also going to make sure that it's not expired. And then we're going to go check it to the patient. Hi, Robert. This is another nurse on the floor. She's going to help me check this blood, all right? We're going to look at your name tag. So we have Robert Crowley and his date of birth, is 1221, and then the MRN number, you can read this one, I'll read this one off here, 815445. Is that correct?
Yeah, that's correct.
All right, does everything look good?
Yeah, everything looks great.
All right, I'll just have you sign up with me. So we have our form over here. Thank you. All right, so we ensured the doctor's order, the blood type matches, name and date of birth and MRN, and then unit number and the tag, expiration date and time. Yes, wonderful. Okay, I'll sign here. Sign here. Awesome, thank you so much.
Of course.
All right, so Robert, before we get started this transfusion, I'm just gonna get a set of vitals from you. So I'm gonna get your temperature, your pulse, your respirations, your blood pressure. Those all look very stable, so we can go ahead and proceed with this blood transfusion. Do you have any questions or anything else for me before we get started?
No.
Great. All right. Okay, so for starters, I'm gonna get out our tubing, and from here these would have caps on them and it would be sterile. I'm gonna go ahead and close this roller clamp. Throughout this whole process, I'm going to be sure to maintain aseptic technique. So I'm going to close one of these, that will be for the blood, just to make sure. Okay, so I would take off the cap. Alright, so with my NS, I'm going to fill the strip chamber so that it is past the filter as per the rubric. Alright, great. So that is above the filter. Now that the chamber is nice and full, I'll go ahead and prime this line with the NS. Okay, nice and primed. Alright, now I'm good to get my blood. I'll just invert it a few times, making sure that all the particles are suspended. And then before I attach the blood, I'll want to lock off my NS line to make sure that it doesn't go back. And here I will open my blood, making sure that I am using gloves. Using aseptic technique, I'll take off this lid, spike it. Now that this is hung, I can grab this again. I can open this, squeeze the chamber, make sure that blood is coming down. Awesome. Okay, now I will prime this line, being sure not to lose any of the blood. Okay, now that it is pink all the way through, going to come over here. I'll program the pump by, I'm going to hook this up while it's clamped to the patient while I'm here holding it. All right, Robert, I'm just going to clean one of your ports, okay? Let's use this red one. Has that been working okay for you?
Yeah.
Okay, so I'll just clean this for 15 seconds. So I'm gonna let those air dry. I'm gonna grab my flush. Maintaining aseptic technique. I'm going to open the clamp, flush your line. So we flush the lines just to ensure that they are still patent, and this will help to clear the line, make sure that nothing is kind of getting stuck in them before we attach the blood. You didn't feel any pain with that, did you?
No, that was great.
Awesome. So before I connect that, I would use another alcohol wipe one more time between connections for 15 seconds. 15 seconds. Let those air dry. Now we're ready to have them connected. Great. So we have the line hooked up. Now we just need to program the pump. Should I turn that on while we were waiting, chatting? Okay, so we're going to be using this channel because it's not being used for your PCA. Okay. Okay. No. Yes. Okay, so we're just going to channel select. Red blood cells, yes. And so for starting it out, we're going to start it pretty nice and slow, about 1 milliliter a minute or 60 per hour. The bag is about 300 milliliters. All right, we're going to get this started. Okay, so I'm going to make sure that everything is unclamped, else it's going to yell at us. Don't yell. Okay, great. Make sure the lines are running. All right, so now that we have that going, I'm gonna stay with the patient and monitor the vital signs again in 5 minutes. So 5 minutes has passed. I'm gonna get the vital signs again. How are you feeling, Robert? Are you having any of those symptoms that we were talking about?
No, sorry. I'm feeling great.
Oh, good.
Yeah, no nausea, no vomiting here.
Okay, that's great. That's great. So now after those 5 minutes, we're gonna wait another 10 minutes, so another 15 minutes, and we're going to get his vital signs again. All right, I'm here again to get your vital signs. Are you still feeling okay?
Yeah, no, I'm feeling great.
Awesome. I'm gonna write those down. I wrote down after 5 minutes and then after the 15 minutes. And since he is tolerating this well, I'm gonna go ahead and change this to be 150 milliliters per hour. That way we can finish the infusion within 2 to 3 hours. So we will continue to monitor him. All right, Robert, it sounds like you're doing really well with this. Do you have any questions for me?
No, nope.
Okay, great. Well, I'm just gonna make sure that your bed is in a low and locked position. Okay, so it's nice and low. You have 2 side rails up. Your call light is just right here. You can push this big red button if you need anything. And make sure that your bed is locked. That's great. All right, well, I'll be in to check on you, okay?
Okay.
So then I will perform hand hygiene on my way out and document the care in the EHR.